Hello, my hospice family. Good morning, good evening, good afternoon. Welcome to Duns Hospice. My name is Nurse Dawn. I am your hospice registered nurse. Welcome to Duns Hospice, where we talk about end of life care because we believe that end of life is life. Okay, I am here to support the caregivers. Okay, please use me. I am at your service. We are going to continue our qualifications as I promised us. I am going to for the next weeks, okay, for the next several weeks, we are going to be talking about, we're going to be discussing what diagnosis, what disease, what illnesses qualifies somebody to be under hospice care, okay? So now we are talking about, okay, we're going to be talking about cancer now. Okay, my beautiful hospice family. Where are we? Where are we? Come and talk to me, guys. Come and talk to me. You know, I love it when I see us. I love it when I see us, okay? A little housekeeping duties as I wait for YouTube to gather us up. Get yourself my book if you haven't done so. It's on Amazon right now, okay? And also get yourself a teddy bear, Rosie. Okay, she's so nice. She's so cute. If you have anybody, okay, who you want to put a smile on their faces, the link is in my description. Please get one for your loved ones. Okay, my beautiful hospice family, come on in. We are going to have a discussion. We're going to continue because so many people have asked me, Nurse Dawn, what would qualify somebody under hospice care? What would qualify somebody? You know, what illnesses do they need to have? And I think this playlist is going to be very helpful, my beautiful people. This playlist is going to be extremely helpful to help to know, for you to know exactly what are the qualifications somebody needs in order to be under hospice care. Okay? And please ask me any questions. As you come in, please give me a like. Okay? And of course, subscribe if you haven't done so. Subscribe and give me a like. Please support the channel. Okay, I am gathering my notes, guys. I'm gathering my notes, and I'm so thankful to you guys. I see that you enjoyed my last video. You enjoyed my last video that I made, okay, in regarding to ALS, and now we are going to continue the conversation. We are going to continue, you know, what qualifies somebody to be under hospice care, what illnesses. Hi, my beautiful hospice family. Come on in, guys. Come on in. It is I, your hospice nurse. Okay, we are live. We are live. Like I said, we are continuing to talk. We're continuing with the topics. Okay, today we are going to be discussing cancer. Okay, cancer is another topic, is another qualification, you know. Okay, I'm putting in the title. Okay, I'm putting in the title. Welcome, my beautiful hospice family. Come on in. Let me know your names. Let me know your name. Let me know where you are from. You know, come and talk to me, my caregivers. I know this topic, it's not the most, you know, upbeat topic, but we absolutely need this. Okay, we need to talk about it. Okay, this channel, it's a great channel. It's going to be, it is a blessing. This channel is a blessing to me, and I pray that it's a blessing to you also, you know, because these topics that we're talking about, they're not easy, but they are necessary. Okay, hello cucumber. Hello. Hello, Miller. Thank you for liking my hair. Thank you. Welcome to DunsHospice, everybody. My name is Nurse Dawn. My name is Nurse Dawn, okay? I am your registered nurse, okay? Here we talk about end-of-life care. We talk about death and dying, okay? I'm a real live nurse. Thank you, Cucumber. I appreciate you. Thank you, Miller. Mwah. Thank you, okay? We are going to continue. Thank you, Maddie. Is that it? Maddie. Oh, Maddie. Thank you, Maddie. I love you guys. You guys are awesome. You guys are so good. Please, guys, help me to grow this channel. Okay, help me to grow. Be part of the community. Okay, make sure you subscribe and like. Okay, we are going to continue our conversation on, what qualifies somebody to be at end of life, to be under hospice care. You see, my name is Nurse Dawn. As I've mentioned, I've been a nurse since 2010, and out of which I've been a hospice nurse since 2012. Okay, and this is very dear to my heart. I want to come here to share my knowledge. Okay, anybody who's watching, who's taking care of somebody who's dying, anybody who's watching who's a caregiver, I want you to know that you are not alone. You're not alone. Please be sure to connect with me, okay? I'm on Instagram and I'm also on TikTok. If you have any questions about hospice care, if you have any questions about the death and dying and how to keep your loved ones comfortable, you are in the right channel, my beautiful people. You are in the right channel, okay? So yes, so we are going to talk about how does somebody with cancer qualifies for hospice, huh? Who watching right now? Okay, who among you watching me knows somebody who's going through cancer right now, huh? Do you know somebody who has cancer, huh? Does one of your family members have cancer? A friend you went to school with? Somebody at work? Let me know. Talk to me, guys. Guys, please talk to me, okay? Because I feed off of your energy. In these topics, okay, it is very important that we talk about these, okay? Because everybody, we are all going to go through it one time or another in our life. We're all going to die. We're all going to die, or we're going to find ourselves taking care of a loved ones. You see? What is this? Oh my gosh, you guys are so funny. It says, there's a girl that I like. He's somebody that I've had a platonic crush on for almost 2 years. I drew his picture. You guys are so funny. This is about end of life care, but you guys find a way to ask me these questions. But I'm going to briefly answer this question, okay? But if you want to know more about relationships, go to my other channel, okay? I have another channel for that. But I'm just going to answer this briefly. 1H, my advice to you is that if the boy likes you back, if he likes you, like, he will approach you. I'm kind of old school. I like to wait for the man to approach me rather than me approaching a man, okay? Because if a guy likes you, trust me, he will not have any problems letting you know, and he will be able to pursue you, you see? But if it's just a picture is innocent. You could just give him a picture, that's fine. But I would not do nothing more, okay, my beautiful lady? Don't do nothing more, okay? We are the prize. Let the men pursue you. If a man is interested in you, he will let you know, okay? All right. Now, that being said, let's talk about what qualifies somebody who has cancer, okay? Mwah. You're welcome, sweetie. What qualifies somebody with cancer to be under hospice care? Now, the number one factor is, has the cancer spread? You see? Because what happens is that you may have, lung cancer, for example, okay? You may be diagnosed, or your loved ones may be diagnosed with lung cancer, and then the cancer stays in one place. But if the cancer travels to another part of your body, like say it started, in the lungs, and now it's in your liver, okay? And there's a medical term for it. It's called metastasis, okay? If it has metastasized, all right, my beautiful hospice family. So if the cancer started in one part of your body and then it travels to another part, that is an indication, your family needs hospice, and your family, should sign up for hospice, because the hospice nurse, the hospice team will be there, to definitely help you in this difficult time. Do you understand, my beautiful hospice family? Let me know. Let me know if somebody right now who's watching, okay, if you have a family, a friend, who is going through this difficult time right now. Because myself as a hospice nurse, I see it all the time. And the scary thing is that younger and younger people, are starting to be diagnosed with cancer. It's just really difficult. It's just like, what is going on? But yes, my beautiful people, okay, my beautiful hospice family, that's one thing. Luzia, hi Luzia, thank you for being here. Thank you so much for being here. Welcome to DunsHospice, okay? You say, may God bless you. Oh, thank you, my love. Thank you. Seek God and call upon Jesus Christ as your only Savior. May God bless you too, okay, my friend? Thank you for being here, okay? I'm going to write a question in the comment. You guys, please participate, okay? Just say yes or no. Just please share your story with me, all right? Do you know someone, you know? Okay, so I just asked us a question, okay? Do you know someone who's currently diagnosed with cancer, okay? And like I mentioned, the very first sign, the very first qualification is if the cancer has traveled to another part of your body, okay? So if it started like in the brain, now it's in your bones, okay? So that's number one, okay? Now, the second qualification is if in spite of therapy. So for example, your loved ones, your mom, dad, husband, wife, neighbor, friend, your loved one has gone through chemotherapy, your loved ones has gone through chemotherapy, they've done chemotherapy, they've done radiation, okay? And they've gone through, some type of operation, to try to take away the cancer. So in spite of aggressive treatment, the cancer continues to grow and spread. You see, that's the number 2 qualification. All right. So the person could be diagnosed with cancer, say in January, and then in January they've gone through chemo, like they've spent about 6 months or so, having chemotherapy, having radiation. And then when they go back to check the lab, to do a scan of their body, the doctor tells them that in spite of us aggressively treating the illness, the cancer is still here. You see? So that is another factor that would qualify your loved ones to be under hospice care. Okay, so that's when, please, okay, call your local hospice company. They would absolutely help you out, because you don't have to do this alone. Because at that point, my hospice family, it's all about symptom management. You see, it's all about quality of life versus quantity. And by the time my hospice patients come to me, they're so drained. They're so drained, they're so tired, because they've been going to the doctors like every single week, at least 2 to 3 times a day. At least two to three times a day per week. You know, can you imagine just having to go to the doctors every single week, having IV put in your veins? Sometimes they have a portacath, they have a PICC line, you know, and going through chemotherapy. And for those of you who know somebody, you know, with cancer, the chemotherapy and the radiation, it kills both your good and your bad cells, you know. So oftentimes, you know, you'll see they have lost their hair, they've lost a massive amount of weight, there's no energy, you know. Oh, hi, Imani. Hello, my friend. Mwah. Thank you for liking my hair, my hairstyle. Thank you, my friend. I'm glad you're here with me today. Do you know somebody who has cancer, my friend, huh? Talk to me, please. Have you ever had to take care? Because I know you are in the medical field, right? So have you ever had to take care of somebody who has a cancer diagnosis? Let me know. Let me know your story, my friends. But yes, like, so like I was saying, it's time to focus on quality of life versus quantity, because at that point, the person has been to the doctors so many times, they've gone through all the treatments, and the doctors say that there's no more cure. So that's where hospice comes in, where hospice will allow you to stay home and be comfortable. You see, like, rather than having to keep on going to the doctors, to keep on, you know, having needles and all that stuff, you know, in you, and it's not even working. Now you get to stay home and focus on your family. You see, focus on the last, you know, few months that you have with your loved ones. It's all about quality. You know, like, how do you want the end of life to look like? We make sure that hospice, the nurse, like myself, we make sure that you are not in any pain. You see, we make sure that we honor your wishes. We make sure that, you know, you are comfortable. Okay, my hospice family. So that's the number 2. Okay, that's the number 2 criteria. Okay, so I'm going to try to list them. All right, so I'm going to try to list them down. All right, in the chat, and please make sure you guys are comment. Let me know if you have any questions. Okay, so we are talking about cancer and hospice care. All right, what qualifies somebody who has a diagnosis of cancer? What would qualify you to be under hospice care? Okay, okay, guys. Talk to me, guys. How you guys doing today? Okay, and then let's see, number 3, the third factor that would qualify somebody to be under hospice care is just simply the patient says, you know what, I don't want no more treatments, I don't want none of it, just let me go peacefully. You know, if the patient say, you know, I've tried chemo and it's doing more harm to my body than good, and I'm at peace with it, let me just spend the last few, you know, months surrounded by my family, you know. And also, my hospice family, I want you to know that nobody has a crystal ball, okay? Because sometimes, and I have witnessed this, and let me know too if you've witnessed this, sometimes the doctor gave you 6 months or less to live, and the person lived years, you know, with cancer. All right, so it's not the end until God says it's the end. Okay, like, I really want us to understand that too. Because just because, you know, you have an illness, it doesn't mean that, like, just because the doctor give you a time, it doesn't mean that's the actual time that you are going to go. Okay? So keep that in mind too. But yes, the third qualification would be if the patient just refuses further treatments. You know, they say, look, it's okay, just let me be, you know. So I am writing this in the chat, okay, my beautiful people. Okay. Okay. So like I said, let me know if you know somebody who has a diagnosis, who's currently battling cancer, and how are they doing? You know, how are they doing? How's the family doing? You know, do you have any questions? And I pray that, you know, all goes well with them. But I want us to understand that there's another option, you know. Hospice is also here for you. Okay? There. Okay? Okay, guys? All right, my hospice family. So you guys are quiet this afternoon. Oh my God, you guys are so quiet. What's going on? You guys are quiet. So that's what I wanted to say. Okay, I want to encourage us, and I want to let you know that it's not easy. It's not easy taking care of somebody with a terminal illness, you know, but let's focus on each day at a time. Let's focus. And I want you to know that you have the power, you have the control of how the end looks like. And I want you to have as much knowledge about end of life so that you can make the right decision for you and for your family. Okay? Because, like, for example, I know with my patients with cancer, some of them, they really have a lot of pain, you know. Like, for example, if the cancer has metastasized to their bones, and so now the person has bone cancer, and that is very painful. And nowadays, as you and I know, doctors are reluctant, doctors are scared to prescribe opioids, you know, things like morphine, things like oxycodone, methadone. Okay, doctors, because of the epidemic that's going on, okay, because of the, you know, people being addicted to these drugs, your regular doctor will be very reluctant to prescribe these medications to you. Whereas the hospice doctors, okay, the hospice doctors, they are more likely to prescribe pain medications to you, to your loved ones, because they understand the end of life process a lot better, you see, because that's what they specialize in. So I have a lot of doctors that I work with, you know, and their specialty is end of life. And these doctors are there to help you, you know, to make sure that you are not suffering, and to believe you when you say you are in pain. Because pain in hospice care, pain is whatever the patient says pain is. If I ask you, if I say, Mr. Smith, on a scale of 1 to 10, what's your pain level? And you tell me that your pain level is a 9 out of a 10 or a 10 out of a 10, I believe you. You know, I have to believe you, because only you can describe your pain. And so I'll go and report your pain level to the doctor, to my hospice physician, you know, and he will, you know, prescribe you medications accordingly. Whereas what the families are telling me, you know, what my patients have told me before they enrolled under hospice care, they would go to their physicians and tell the physicians that they're in pain. And the physicians would act like, I can't do nothing for you, you know, I mean, you know, and that's really sad. You know, that's really unfortunate. And so I just want you guys to know that there's another option out there, okay? And don't be afraid of hospice care, because hospice is not the reason why your loved one is dying. Hospice is just another service. It's a free service that is often covered by your Medicare, Medicaid, okay? And it provides you with a lot of support. Okay, my hospice family? All right. Well, that's what I wanted to say this afternoon. Thank you so much for being here with me. Thank you, Medical Mommies. Thank you, Luzia. Thank you, Refried. 1HN. Hello. Thank you, Maddie, Miller, Cucumber. Okay, thank you guys. Thank you so much for commenting. Thank you for being here with me. If you haven't done so, please subscribe, okay? And give me a like. Feel free to share this video with anybody you know right now who's going through a cancer diagnosis, okay? I pray that they are healed, they're healthy, okay? But please stay with me, all right? Let's build this community together, okay? Okay, guys? All right, I'll see you in the next video. All right, be good to yourself and each other. Bye-bye now.